Hey guys! Today we're going to talk about the key bodies in healthcare.
So, first is the General Medical Council. They have many roles in healthcare, and these include setting the standard for doctors, overseeing doctor training and education and supporting doctors in their training, and managing the UK Medical Register by checking each doctor's identity and qualifications before allowing them to work. If a serious concern is raised about a doctor, they will be inspected, and if the case is very serious, such as in Harold Shipman's case, they risk being struck off in the register. Also, they ensure that every doctor has an annual check and appraisal and a formal confirmation every 5 years to make sure each doctor is following the good medical practice.
Next is the Clinical Commissioning Groups. It was created following the Health and Social Care Act in 2012. They are clinically led NHS bodies responsible for the planning and commissioning of healthcare services for the local area. It's mostly made up of GPs and other healthcare professionals. It's responsible for about 2/3 of the total NHS England budget. It's responsible for authorising healthcare, including mental health services and urgent and emergency care. And it's independent, and the Secretary of State for Health through NHS England, which is like right now Jeremy Hunt, is responsible for it. It's responsible for the health of populations, and each one is responsible for about 250,000 people.
Next is the NHS Constitution, which establishes the principles and values of the NHS. It sets out rights to which patients and staff are entitled to, ensuring that the NHS operates fairly and effectively, and it's reviewed every 10 years. It lays out 7 principles. This includes that the NHS is for everyone, whatever their age, etc. Also to have free healthcare as far as possible, as long as Parliament agrees, to provide high quality care and to involve patients and carers in deciding about the provisions of service, also to work with other services to provide better healthcare, to spend taxpayers' money carefully, and to be open and transparent about how money is spent.
This is the Royal Colleges. These are professional membership bodies that you can join dependent on your area of practices. They can set standards within their field and maintain them, such as patient care. They supervise and support doctor training once they have passed a number of exams. They develop policy and guidance. And that was it.
Next is the British Medical Association. They're the professional organisation and trade union which protect and advance the interests of its members in the workplace. The members are protected under BMA law, which gives legal advice to doctors for when they're working as well as for their personal.
Next is NHS Employers. It's the voice of the employers of NHS England, which reflects employers' views and acts on their behalf in 4 priority areas. The first priority area is pay and negotiations. Next is recruitment and planning the workforce. Then it's healthy and productive workplaces. And last, employment policy and practice.
Next is the Medical Defence Union and Medical Protection Society. These are the 2 largest defence unions for doctors, and they insure doctors against lawsuits and represent them in court or GMC hearings. And they also provide educational activities for their members.
Next is the National Institute for Health and Care Excellence. It provides guidance and advice to improve health and social care. Mainly, it provides guidance with health technologies and which ones should be used in the NHS. Interventional procedures, which assessing the safety of procedures and providing information on their findings. Clinical practice, which treatments are the best for people with specific conditions. And public health. It publishes guidelines on 9 different areas to promote health, such as smoking and obesity.
Next is Care Quality Commission. They inspect and regulate 12 different services, including ambulance, dentist, and home services, and they have different methods of inspecting each place. But generally, inspection involves registering people that apply to them to provide services, using data, evidence, and information throughout their work, and using feedback that people have given them to help them reach their judgments, Inspections are carried out by their experts and they publish information about their judgments, and they also publish a rating, and they also take action when they judge that services need to improve and make sure that those responsible for poor care are held accountable.
Finally, it's Monitor. It's part of the NHS Improvement, which supports providers to give patients consistently safe, high-quality, compassionate care within local health systems. Therefore, Monitor looks after the finance of different NHS trusts, enables integrated care, it safeguards patient choice and prevents anti-competitive behaviour, which is against the interest of patients, supports commissioners to protect essential healthcare services for patients with financial difficulties. Thanks for watching. We also want to mention that these are just the bodies in NHS England, and if you're applying for unis in Scotland or Wales or Ireland, you might want to research the others too.
We hope you found our video informative.
Bye!